Doctor, is there a possibility of having an abortion after IVF treatment? You are selecting the sperms and the eggs. Why should an abortion happen?
In a normal pregnancy, if a couple have, in a statistical situation, if 100 people conceive, 15 to 20 people lose the pregnancy. That happens for various causes, be it quality abnormalities of the baby, abnormalities in activating the genes, or environmental influences, or effect of infections, or body rejecting a pregnancy. But the most commonest cause for abortion in a woman who conceives normally is an abnormality of the genetic material, also known as aneuploidy. It's nature's quality control to prevent an abnormal pregnancy to come into this world and the negative consequences of it. When nature does its quality control job, we are unhappy. But if it fails to do a quality control and have an abnormal pregnancy, an abnormal child, again we are unhappy. But the reality is, whatever we want, still nature plays a role. In IVF, similarly, there is a pregnancy loss because you are only producing an embryo. That means you are creating a life up to 8 cells to possibly blastocysts, where 100 cells are there, but never into thousands of cells. And then that embryo can look normal, but it has to further progress for 14 days. And then afterwards, it should further progress for 2 weeks before we see an ultrasound. And then progress for another 10 weeks or 8 weeks from the time of the positive test, wherein we can make out major abnormalities to a large extent. So when a pregnancy loss happens with a blood test positive, but the scan does not show anything, it can be said a bilingual pregnancy. When the ultrasound shows a pregnancy which is inappropriate to the duration of the period and with no formation of fetus, we say a blighted ovum. Then the other category is the formation of the heartbeat, and then it subsequently stops, which is called a fetal demise or a pregnancy loss due to various reasons. In an IVF pregnancy, earlier people used to think it reduces the abortion rate. But the answer is, whatever happens in a natural pregnancy, all rules apply to an IVF pregnancy, be it abortions, be it abnormalities, be it hypertension in the mother or pregnancy-induced diabetes in the mother, bigger babies or smaller babies, whatever applies to a normal pregnancy happens. In fact, in few times, it's on the higher side because here you're treating a failure of nature to produce a natural pregnancy. Whereas in the other situation, a normal pregnancy, nature is playing its role of quality control. Here you're trying to disturb a situation where nature doesn't want the pregnancy to happen, and we are trying to correct it, and still nature protects it. What are the current ways of avoiding that situation? One is pre-pregnancy evaluation is important of having optimal health. The second is the precautions for the male in terms of health, weight, diabetes, smoking, alcohol. In the woman, similarly, smoking, alcohol, control of weight, and a healthy pre-pregnancy nutrition will minimize some problems to a certain extent. And during the transfer of the embryo, there are certain embryo selection methods which possibly reduce but does not eliminate abortions. The current technologies in those areas are, one is time-lapse embryo monitoring, the second is pre-implantation genetic diagnosis. That means we take a biopsy from each of the embryos and then select whether there is any chromosome abnormality and then transfer those embryos. Even after we transfer a selected embryo, it does not assure you that there will not be a chance of miscarriage, but reduces the chance of miscarriage. Any couple who are planning an IVF should also anticipate the possibility of a baby, the possibility of pregnancy test without seeing a baby, or a miscarriage. So IVF is not an assurance that you'll have 100% a baby, and even if you're pregnant, it does not mean all pregnancies which are found by IVF end up in a live birth. So there's a new definition that is coming in where a clinic should say what is a live birth for started IVF cycle. That is a better indicator of a quality control of that clinic. And what is the miscarriage rate, preterm delivery rate, and the other complications. So a lot of people can say, I have a 70% pregnancy rate. That can be a HCG value around 30, or they mean they have seen the heart pregnancy sac at 6 weeks, or they have seen the heartbeat formation between 6 and 7 weeks, or the 12 weeks pregnancy. One should ask, what do they mean by pregnancy rate? And another term is an ongoing pregnancy rate. Finally, the most important thing is the live birth rate per started cycle is the ultimate thing which defines a quality of the clinic.